we now discuss the practical part of the diseases of kidney, including the congenital disease, the cystic diseases of the kidney, and renal stones, renal tumors, and the tumors of urinary bladder. First, this is a horseshoe kidney. Two kidneys, right and left, are fused from the lower lobe, and this, as we mentioned, this congenital anomaly is associated with increased risk for infection. Here we have autosomal dominant polycystic kidney disease. The kidney is enlarged in size, and the cut section shows multiple cysts of variable size. Here we have renal dysplasia, which is one of the developmental diseases of renal cysts, forming renal cysts. Grossly, it shows multiple cystic structures. Here we have multiple cystic structures, and here we have the parenchyma. Microscopically, it shows tubules that forming cystic structures, and the primitive stroma that contain a focus of cartilage. So this is renal dysplasia. The most important characteristic features are dilated tubules, primitive stroma containing cartilage. This is a staghorn stone, which takes the shape of renal pelvis, and associated with hydronephrosis, we have cystic dilation of the renal calyces. Now, tumors of kidney. This is the most common childhood malignant tumor of the kidney, which is a Wilms tumor, or is also called nephroblastoma. Here we have well circumscribed mass, which is large and seen in the upper part of the kidney. It consists of multiple areas of hemorrhage and focus of cystic structures. The tumor is pale yellow color. This is microscopically Wilms tumor. Here we have three components اللي هي البلاستيما, the epithelial component, and the stromal component. البلاستيما component هي primitive embryonal cells, and هذه اللي تدخل Wilms tumor بواحد من differential diagnosis of small round blue cell tumors, because this component is small, embryonic, hyperchromatic, and dark, يعني blue stained. الابيثيليال component هنا عندنا primitive tubules أو tubules lined by primitive epithelium. The stromal component هي الميزنكايم. هنا loose stroma, pale edematous stroma that contain spindle cells أو fibroblasts, كلها تكون primitive. هذه renal cell carcinoma, most important, most common type of renal cell carcinoma هو clear cell carcinoma of the kidney. هنا عندنا well circumscribed tumor with irregular cut section, heterogeneous cut section, shows these yellow areas. هذه اليلو areas هي lipid laden and glycogen rich tumor cells. البيل هذه الوايت cells هي necrotic areas اللي commonly seen in renal cell carcinoma. وهذه red spots هي hemorrhagic spots commonly seen in renal cell carcinoma. Microscopically, tumor cells show this multiple nest of malignant cells, and these nests are separated by delicate fibrous stroma containing small capillary sized blood vessels. إذا نجي على التيومر سيلز نشوفها كلير أو بيل. هي بالحقيقة مو كلير، هي contain lipid and glycogen، لكن because of that lipid and glycogen does not stained by our يعني روتين stain اللي نستخدمها بال يعني preparation of tissue، لذلك تطلع بيل. إذا نشوف النيوكلياي هنا، احنا وحدة من الفيتشرز of malignancy اللي تساعدني بالدايجنوسيس هو البليومورفيزم. هنا اكو عندنا exception. البليومورفيزم is not a feature of clear cell type renal cell carcinoma. تقريبا هنا اكثر السيلز هي monomorphic. Nuclei also monomorphic with no pleomorphism in shape and size. This is urothelial carcinoma in situ. احنا urothelial carcinoma in situ هي that the features of malignancy اللي هي pleomorphism, hyperchromasia, high NC ratio, loss of polarity, lack orientation, prominent mitotic figures. هذه الفيتشرز كلها هي features of malignancy. بالكارسينوما انسايتو اشوفها within the lining epithelium and يعني ما عابرة البيزمنت membrane of the epithelium. هذه اللامينا propria contain multiple chronic inflammatory cells أو lymphocytes، وهنا blood vessel. نرجع malignant tumor أو carcinoma in situ. احنا normally lining epithelium أو urothelial tissue epithelium أو transitional epithelium ب 3 layers: البيزال layer, intermediate and the most superficial أو upper layer اللي هي umbrella cells. هنا umbrella cells is lost، وعندنا multiple mitotic figures تكون موجودة، والcells lack of polarity أو lack of maturation أو lack of their normal orientation اللي هو normal orientation of transitional cells تكون perpendicular to the basement membrane. هنا كله راح يكون lost. اكو pleomorphism، اكو variation in shape and size, and the cells are hyperchromatic, and these changes are seen in all layers of the lining epithelium but not extends beyond the basement membrane. There is no invasion, so this is carcinoma in situ, CIS. This is urinary bladder showing this tumor, which is fungating tumor or exophytic tumor in the bladder neck with multiple small papillary structures seen in this tumor. So it is urothelial carcinoma of urinary bladder showing large fungating mass in the bladder neck. Microscopically احنا البابيلاري كارسينوما قلنا either low grade او high grade. على شنو اعتمد على الcellular feature that او cellular feature that line the papillae. هذا papillary structure finger like projection above the surface epithelium with a fibrovascular core. هذا هو الفايبروفاسكولار core موجود. الcells that line this papillae are يعني slightly disorganized، والfeatures of malignancy موجودة هي يعني، لكن مو كلش prominent. يعني اكو pleomorphism، اكو high NC ratio، اكو increased number of layers of the cells، لكن not extremely aggressive features. Still يعني mild pleomorphism، mild hyperchromasia، mitosis موجود، لكن infrequent، مو مثل الهاي باور الهاي grade papillary urothelial carcinoma of urinary bladder. نشوف هذا papillary structure with central fibrovascular core, and the features of malignancy are prominent here. The cells are more aggressive, showing prominent variable size and shape, prominent hyperchromasia. Lack of maturation is very clear here. Lack of orientation also is very clear. نشوف السيلز النيوكلياي كل وحدة رايحة بدايركشن مصاير تكون يعني المفروض هي perpendicular to the basement membrane. هذه invasive papillary urothelial carcinoma with high grade nuclear feature invade the muscularis propria layer of urinary bladder. المسكولارس propria هي هذه السبندل cells acidophilic spindle cells. هي هذه smooth muscle bundles of muscularis propria layer. إذا muscularis propria showing these nests of malignant epithelial cells. They infiltrate from the surface downward towards the deep layer of the wall, towards the muscularis propria.